EUS stands for Endoscopic Ultrasound. So it's one of the tools that we use to be able to investigate what's happening with the digestive tract. It's a procedure whereby we go through the organs of the digestive tract and we use the ultrasound to be able to see through the organs where we're located. And a common question is, how is it different than some of the other tools that we use? When we do an upper endoscopy or a colonoscopy, we're usually just looking at the organs where the camera is located. But there are other organs that we can't see when we're doing those tests, like the pancreas, for example. The pancreas is located outside of and behind the stomach and the small intestines. So how would you see that? Well, EUS helps us to be able to do that.
There are many different applications for endoscopic ultrasound. Oftentimes, we may do endoscopic ultrasound to follow up on a CT scan or an MRI that may have shown something surprising or incidental, maybe a cyst in the pancreas, a mass somewhere, some kind of abnormal finding that needs some further characterization or sometimes even a biopsy to sample it. So first of all, patients are sedated for the procedure. Similar to an upper endoscopy, they're sedated in such a way that they're asleep, not feeling anything, but still breathing on their own. And then we go with the device through the mouth, down into the esophagus, stomach, first part of the small intestine, whatever may be appropriate. There are a few times that we may do EUS through the rectum, usually just specifically to look at the rectum or the muscles in and around that area, but those are less common. The vast majority of them are through the mouth in the upper procedures.
EUS can vary. It can sometimes be a very short procedure, sometimes 15, 20 minutes. I've had times where it takes much longer. It just depends on what we're looking for. But it is an outpatient procedure, so you still go home that same day. And then afterwards, you might feel a little bit sleepy because of the anesthesia, but you're typically able to walk and talk and eat and do the things you would normally do. We do usually advise you not to drive that day because you've had anesthesia, and to not work that day because you've had anesthesia. By the following day, you can resume all normal activities.
The only prep for the endoscopic ultrasound is really just having patients not eat after midnight the night before, just like with any sort of procedure where you're going to get sedation. But other than that, there's no specific prep, nothing that you have to drink before the procedure.
EUS is just an incredible tool that we have in order to be able to learn more about what's happening with the digestive tract.
And it's a pretty straightforward, well-tolerated, safe procedure, similar to an upper endoscopy. And we're excited to be able to offer it here at Sentara, Northern Virginia.